The mission of Morehouse School of Medicine is to serve individuals, community, and the nation. When students are trained, they're trained to know that they are going into the community to provide primary health care, to serve those underserved areas. We don't go into the community and tell the community what we want to do with them relative to research. We go into the community and say, what is it that you need for us to do?
The Morehouse School of Medicine's Prevention Research Center was established in 1998 and was designed to facilitate equal partnership between community residents and academicians or researchers. The mission of the Prevention Research Center is health promotion and early risk reduction among African American and other minority communities, and we specifically call this a coalition for health. The underserved populations really represent those whose socioeconomic status and even physical environments make them at increased risk for health outcomes including cardiovascular disease, HIV, even diabetes and asthma. And prioritizing them through thoughtful community-based research is important. It allows us to identify the types of health promotion research that should be conducted that will be most effective to bridging the gap between the haves and the have-nots.
There is a high incidence of HIV in the communities that the Prevention Research Center services, particularly among women and youth. Our current research project is an HIV and STI prevention project among urban youth. We are going to incorporate the parents, and we're also going to be looking to incorporate technology, social media, into these interventions as well. What we want to do and what the purpose of the research is to, one, increase knowledge about HIV prevention and STI prevention, but also to help parents communicate with their children about these particular issues.
We need research rigor to turn the ears of policymakers and to make change in terms of health outcomes. But without established community credibility, not only will the community not come, but they won't buy in or engage. Our Community Coalition Board is composed of a community resident majority. Any health initiative that we develop has to be guided and steered by them.
My role as chair of the Community Coalition Board really is to ensure that in every aspect of the work, community residents are participating with academia to ensure that these projects are just not research projects, that are projects that really help to enable neighborhood residents to move forward, but also kind of provide the knowledge and the data back into the neighborhood so that it's owned by the community.
Weight loss equal health gain is a mini-core grant that we received through the Community Coalition Board at Morehouse School of Medicine. And it is about the community getting well. It's about nutrition, health, losing weight, doing what we need to do within the community to pass on not just to this generation, but to generations to come, about better eating, about being more physical. Morehouse made it possible, so we have our own answer in our own community, which will meet the needs of our participants here.
My organization, Redemption and Advancement, was awarded the mini grant from Morehouse School of Medicine because we focus in on violence prevention and men's overall health. We're looking at serving 25 to 35 men who have been impacted with incarceration, being able to reach out to these individuals, help them to understand what it means to live a healthier, productive life, not only through making better decisions, but also with making healthier decisions for themselves with the way they eat, drugs and alcohol. There's studies that directly link doing these things in a better way to making better decisions and being able to change lives.
The south side of Atlanta is really being neglected because we have more vacant houses, we have high-class graffiti, things that are just not conducive to good living. We have had people to come in to help us with HIV. diabetes, and things like that. That's how we are impacting our community.
What we're clear about is that people have to be well and healthy in order to be those individuals that move to better jobs and employment that helps us to create better communities. Neighborhood residents can really look to this institution being a community partner and saying that they helped us to deal with issues that we face on a daily basis that allowed us to improve our quality of life.
Underserved communities and their disparities should be important to all of us, and addressing the needs in a community-engaged way that makes sense not only impacts them in a positive way, but it means improved health for our nation.